Hi everyone, I am doing a new video. We are going to be interviewing my sister, Roya Moheimani, and she is on the line right now. Roya, go ahead and introduce yourself to the audience.
Hi, I'm Dr. Moheimani. I'm a resident and I'm studying musculoskeletal medicine at UCLA. And today I'm going to talk to you and give you a short talk on the use of PRP or platelet-rich plasma injections for the meniscus.
Okay. And before we go into this talk, can you just give us a little bit about your background, like how you decided to choose sports medicine and why you decided to research PRP?
So that's a great question. Part of the reason why I was interested in musculoskeletal medicine is because I'm an athlete myself. I've always been interested in the human body and healing after injury. The new field of regenerative medicine is a huge new thing in medicine that everybody is very excited about. And using your own body to get better instead of surgery is the new cutting edge in the future of medicine. So that's what my interest in PRP or platelet-rich plasma came from.
Okay, cool. And what made you decide, or how in your program, like what part of your program allowed you to create this like lecture or whatever to get you started to do research on this?
So the field of medicine is constantly growing. The fun thing about being a doctor is that you're always looking for new ways to help your patients out. PRP has become a very big buzzword. A lot of people are very interested in it. So I was interested to see exactly what applications there were for PRP in meniscal injuries. And we'll talk about this more in the talk, exactly what the meniscus is. But the whole idea of PRP injections is a huge field in itself because there's so many different areas and applications of PRP that have yet to been discovered.
And if you guys have been following this channel, I have got PRP treatments for my receding hairline, my black eye, and my tennis elbow, but it's technically golfer's elbow. So what is that called, the golfer's elbow injury that I had?
So we call that medial epicondylitis.
Okay, so yeah, I had that injury, and I'm proud to say, if you guys have been following this channel, the pain is completely gone. I'm not playing tennis as aggressively as I used to, but I'm playing for pain-free again. And for the longest time, I wasn't even able to do a forehand. I had to consistently do slices if you are a tennis player. And because of I believe I did 4 PRP sessions, and I haven't gone back for any more PRP recently, but I'm basically pain-free, and it's like I'm back to normal. And a quick question before we go in through the slide. Now, because I had that tear and I got the PRP injections, is it now stronger, or what exactly what happened to my elbow once I got the injections?
That's a great question. I don't think there's enough evidence or research to say that whether or not PRP would make the tendon or that insertion area stronger, but it definitely does help with healing and regeneration. We know that with bone, break a bone and it reforms, the bone that gets laid down is actually even stronger. But with tendon and ligamentous injury, it's a lot more because there tends to be scar tissue. And that's why PRP is so key, because the idea is that in these areas with chronic injury where there's scarring, there isn't good blood flow. And so platelet-rich plasma kind of promotes blood flow to that area.
Okay, so it's only the bone then. So if I get a bone fracture, it's gonna heal stronger. But if it's like a meniscus tear, or like if it's not the bone, then it's not gonna grow back stronger. Is that correct?
Yes, and for the bone injury, a lot of that also depends on the type of fracture, if it heals, if it's displaced or non-displaced, and that would be an entire lecture of its own.
Okay.
So my simplified answer is yes, but that actually comes with a caveat.
Okay. All right. So let's go ahead and now move on to the first slide, and we're going to be breaking this up into multiple videos, guys. So this is going to be our part one. Um, so give me one second. I'm trying to I haven't used PowerPoint in a long time, so here we go. Okay. So the outline. Can you go ahead and read out the outline for us?
Yeah, so for the talk today, we're going to review the basic anatomy and imaging that goes on with the meniscus. We'll talk about what my inspiration was for doing this PowerPoint, and then we're going to talk about the literature, which are, for the scientific audience out there, case reports and retrospective studies.
Okay. And should I go ahead and move on to the next slide?
Yep, go ahead.
Okay. So you want to go ahead and explain this slide here?
Yeah, so we'll just quickly review the knee. So you can see in the left image, there's the femur, which is that big bone in your leg, the tibia and the fibula, which is the smaller bones you have in your calf. Everybody knows the ACL, which is in the middle, which is a very important ligament that provides stability. The meniscus, which is kind of sandwiched in between the major bone, the tibia, and the femur, kind of sits there and acts as padding and kind of allows for that fluid movement of the knee as it moves up and down. And then the image to the right, which looks like, two moons almost, or two C's, that's a cross section looking down at the meniscus. You can see the medial meniscus, which lays more towards your midline, and then there's the lateral meniscus, which is more on the outside.
And so to keep this entertaining, because like I said, you're a doctor, you're very smart, but us basic people, to make it more entertaining for us, do you know any famous athletes that have gone through some of these injuries so they can kind of relate to, because I see all these parts, like I've heard of the ACL, I've heard of like the medial, the MCL and all that stuff, but can you maybe like give us some insight on like what is more commonly injured, what is not injured as awesome?
Yeah, and we'll talk about athletes that inspired this talk for the meniscus, but for the ACL, I mean, that's a common, game season-ending injury. Tom Brady had an ACL injury, which basically took him out for that entire year for the Patriots. So when someone injures their ACL, you've probably heard of that. Happens with, direct blows to the knee or jumping up and down. A lot of basketball players might blow their ACL. So that's why a lot of...
Why is the recovery so long? Why does it take so long?
So ACL is very complicated because you have to have a surgery, and then the rehab time with the surgery takes a really long time. So that's one of the reasons the ACL takes so long, is that you're either taking a graft from your own tissue or from a cadaver and inserting it to replace...
When you say graft, can you kind of explain a little bit more?
So a graft is when you take tissue from somewhere. So you either graft from your own tissues, they'll take a piece of your tissue from somewhere else and put it into the knee joint. And then the other one is you take it from a cadaver, from a person that's already passed away. And this is very complicated because you're inserting a new tissue into the knee joint. So it takes a while for it to heal. And then you have to rehab all the muscles because you have to be immobile for a while. So it's a complicated injury. The meniscus is a little bit less complicated. Some people might remember Meta World Peace or Ron Artest.
Yes, the panda's friend.
Yes, he was pretty remarkable because he had injured his meniscus and he came back in like 4 weeks. And he himself even said he may have rushed back from the injury too fast. The meniscus is a little bit different because the meniscus is a lubricating agent. It doesn't hold the knee together as much as the ACL does, so that is possibly why it's easier to recover from a meniscal injury. But again, you'll see in the next slide I'm going to discuss, it really just depends on the severity of a meniscal injury, as opposed to the ACL. When you tear it, your knee will feel very unstable because it's almost like it's like the lock that holds the knee together. So without the ACL, you can imagine that the knee can kind of slide back and forth. So meaning the femur and the tibia, the two bones, can kind of slide back and forth.
Okay, and before we go to the next slide, just being, a weekend warrior, I'm a very active person, and this is one of my nightmares. I would never want this to happen to me. Is there anything preventative that we can do? Can I become more flexible, yoga? Is there anything we can do to reduce the risk of this kind of injury or these injuries?
So, absolutely. I think there's two different things that I can think of, and both of them, so in the preventative nature. The first one is making sure that you're stretching, keeping your quads and your hamstring muscles.
And when you are stretching, is it okay? So I was told, and you can now debunk this stuff, but I was told that you should always stretch after you're done with your workout. If you stretch before your workout, it's not supposed to be good.
So there's different opinions on that, and I don't know if there's any research necessarily that proves one way or the other. I'm talking about more just stretching, not the one time before you exercise. I'm talking about lifelong stretching, like always making sure that you're at your maximum flexibility.
What do you recommend then, like once a day?
There are patients that have something called hypermobility syndrome, which they're predisposed to ligamentous injury. And those patients, they're already very lax, so sometimes we tell those patients not to stretch. That's why you should always talk to your doctor, because medicine's very complicated. There is no one recipe for everyone. But in general, with most patients, making sure that your muscles are well stretched out before you go into vigorous activity is important, because having that flexibility kind of prevents that rigidity that would cause these entities to tear. The other really important thing I can say is activity modification and knowing kind of what your limit is. So you'll see a lot of athletes that play high school sports will take time off and then they'll go straight into playing basketball or soccer, and they don't really build up their muscles leading into the exercise. So knowing kind of how to progress into exercise may help. And then also, you know, when you're playing basketball, the way you play can also protect your knee. So a lot of jumping is going to really affect your ACL and your meniscus. So that aggressive rebounding, driving to the hoop as you get older is going to set you up more for a knee injury as opposed to shooting from the outside.
Okay, so as because I'm about to be turning 32, I should consider stretching more, which I already do, and I usually do stretch after my exercises, but also modifying my game so I'm not going in there banging, staying outside and taking outside shots. Correct? Is that like the recommendation?
Yeah, and then obviously if you have had an injury before, making sure that you wear your proper brace for activity.
But I've never had this injury, so I don't need to wear any braces.
Yeah,
Just
I would not recommend wearing a brace if you've never had the injury before. That actually weakens the muscles and is counterproductive.
oh, I did not know that. Okay, cool. So just for now, stretch and stay away from dangerous situations. And that's what age would you say you should start looking into that? Like around your 30s or what?
Looking into,
Playing less aggressively because I don't think it's okay. I mean, you shouldn't be telling a 16-year-old to not drive and do all that, right? I mean, when they're younger, they should still be playing 100%, right? Or no?
right. I mean, I think it kind of depends on the person. So some certain athletes, you know, they're not predisposed to knee injuries, and so they're okay. But you know, as you start to get older, in your mid 20s and 30s, your body becomes much slower at healing. So that's when you should really think about modification of the
Okay,
weight.
mid 20s and 30s. I'll just say for me personally, 30s is where I drew the line and started to modify my game. Before we go to the next slide, though, I'm going to cut this video off and we're going to go ahead and make another video. So thank you very much for your time, and we'll start the lecture on a new video.